Hello and welcome to Docplexus News. The Bihar State Pollution Control Board has directed closure notices to 141 private hospitals for violation of environmental norms and discharging untreated effluents into the nearby water bodies. The inspection was conducted across the state to assess the hospitals not having effluent treatment plants installed or are not operating them regularly. The State Departments of Public Health and Medical Education has a new policy attracting doctors to work in rural areas. According to this policy, if the doctor works for National Health Mission, he is exempted from 1-year mandatory rural service after MBBS. This initiative is a positive step encouraging students to work in both rural and urban areas. The Central Information Commission has directed the MCI to give complete inspection reports of all medical institutions in the country within 6 weeks. The Council is a regulator of medical education infrastructure in the country and also monitors the number of seats, course structure, and quality of education. A study suggested that prenatal folic acid fortification reduces the incidence of severe mental illness like schizophrenia that initially appear in young adulthood. Grain products such as enriched bread, flour, etc. are fortified with folic acid, which reduce the risk of neural tube defects. Increase in utrofolic acid exposure is found associated with changes in later brain development and predicted a reduced risk of psychosis. A recent study claimed that the patients with non-metastatic adenocarcinomas of gastroesophageal transition may have a better prognosis if their tumor cells produce the signal molecule PD-L1. It was estimated that PD-L1 is expressed in patients not pre-treated with immunotherapy, and it is an independent and powerful predictor of favorable disease progression. The nursing union at AIIMS Institute has alleged that the newly opened ward at the AIIMS Trauma Center is ill-equipped and lacking in manpower. The ward is run by the existing pool of paramedical staff, which has resulted in scarcity of existing as well as new facility. Key facilities like defibrillators, centralized supply of oxygen, and central suction system for patients are also missing, which is an alarming situation. According to ICRA, regulatory hang on the hospital sector would persist with further pricing restrictions on the products and services in the future. The regulatory actions by NPPA of stent price cap has adversely impacted the revenues and margins of the hospitals. The NPPA has further stated that there is a need for regulatory action to curb the excess profits earned by hospitals. The National Health Agency launched a formal process to empanel public and private hospitals across India for Ayushman Bharat and achieve universal health coverage. The aim is to provide financial protection to 10.74 crore deprived rural families and occupational categories of urban workers' families as per the latest socio-economic caste census data. Improper nutrition is the underlying problem of NCDs, which needs to be urgently addressed in a sustainable way. In the light of this issue, a mobile app has been developed by Hyderabad-based Indian Council of Medical Research. This mobile app, namely Nutrify India Now, offers comprehensive nutrition-related information, especially for the Indian food. The app provides information on several parameters such as protein, vitamin, and mineral content of the food items along with caloric value. It is based on authentic and a well-researched exhaustive data with compliance of guidelines by ICMR. The app is an important part of the Prime Minister's National Nutrition Mission. It also marks the first step towards combating non-communicable diseases. Let us know your views on this app by commenting below. These were the latest happenings in the medical field brought to you by Docplexus, one of the largest online communities of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!